A very good morning to you, and welcome once again to our Glaucoma Awareness Series in partnership with the Eye Specialist Hospital right here in Enugu, the cool city. And today we are shining the spotlight on a topic many people are unaware of. And that's glaucoma in children, childhood glaucoma. When most of us hear the word glaucoma, we immediately think of an eye problem that comes with age. But the truth is, little eyes can also face a big risk. Childhood glaucoma, though rare, is real, silent, and potentially devastating if not detected early. So, how do we recognize it? What are the warning signs parents should never ignore? And most importantly, how can we protect the bright future of our children by safeguarding their sight? Joining us to unpack this important conversation is an ophthalmologist, a consultant ophthalmologist, Dr. Suhanyo Keke from the Eye Specialist Hospital. Good morning once again.
Good morning, UC, and good to be here this morning.
Okay, let's try to understand this because one will say, what did the little child do to be given glaucoma? So, doctor, when we talk about childhood glaucoma, what exactly does it mean?
Okay, interesting topic, interesting questions. Now, we have long talked about glaucoma. Blinding disease still remains a blinding disease, whether it is a child, adult, or at any stage. It's a blinding eye problem. But the particular focus today is glaucoma in children. Now, glaucoma in children is a very rare form of glaucoma. It is very rare, quite not very common. That is what I mean when I say rare. Now, unlike the adult form of glaucoma, it has high chance of getting a child blind if it is diagnosed early, if it is not diagnosed early and treated early. So it's a blinding eye condition, and it is usually genetically inherited. Normally you have what you call the primary congenital glaucoma, in which case the child presents with the disease at birth or at the first year of life. That is the commonest form of primary congenital glaucoma. Then we have other forms of glaucoma called the juvenile open-angle glaucoma.
Okay.
Juvenile open-angle glaucomas are similar to adult open-angle glaucoma,
Okay.
but this time around the age of presentation can be between 4 years of age to 35 years of adulthood. And then we also have the secondary glaucomas. Secondary glaucomas can come as a result of trauma. Trauma is accident, so anything that has involved the eye, some violations to eye ocular tissues, sometimes improper use of medication like steroids, most times over-the-counter medication. When you go to a chemist, the eye is red, drugs are prescribed, and parents now use that same bottle, keep buying, and it increases the eye pressure. Some ocular conditions, infections, these are all the things that can give you secondary glaucomas. But the primary one is the primary congenital glaucoma. It is
Children are born with it.
Children are born with it, or they will present at the first year of life. And it is important to know it is a blinding eye condition, and unlike the adult form, the only treatment available for it is surgery.
Surgery.
Eye drops, lasers don't really have a significant role to play. So an early intervention, surgery done, can preserve the sight, and as I have told you, is genetically inherited, and we sincerely do not know who will inherit what, because genetic testing in our environment is not prevalent, and
Okay.
if available, it can be very exorbitant. So sometime trying to know who have family history. This time around, it is not just family history of glaucoma. You want to know those who have children that have had glaucoma in the past. Okay, if a father and mother whose both parents have such history, there is a likely chance that you can have a baby that can be born with congenital glaucoma. The prevalence is quite low in the developed countries. For instance, for every 15,000 births, you can have a child born with
Okay.
it. But in some African countries, it can come to as low as for every 1,000 births of children, live children, you can have one. And in Africa, you can actually have it at least for every 700 births, you can have one child. So
Okay.
it is there, and we must pay attention to that. So it is good to know such things exist, and what can we do to prevent such things. And if it happens, are we going to blame game, or are we going to take the bull by the horn, and how do we tackle it? These are the important things. And then some things, when a woman gets pregnant at this stage, because we are talking about congenital glaucoma, primary congenital glaucoma. A child is being born with it. There is actually a structural or developmental anomaly. You know, the father contributes, the mother contributes, the egg and the sperm come together to form the baby. Now, so as simple as the egg and ovum is, you can imagine two small structures coming together to produce the child. So between the stages of 0, that is the first day of conception, to the last day of conception, okay, that is 9 months, there is a lot of changes that takes place in the womb of the mother. So it's a very delicate period. A lot of things happen, and for some reason, even when there are no triggers, some developmental anomalies, that is the way the cells have to divide and form and structures have to be developed, may not occur in some children. Sometimes it is some environmental factors that play a role. Sometimes maternal infection, what she takes during pregnancy, all these contribute to some structural defect in the child. So it is important to know that pregnancy is a delicate period. Every woman who is pregnant should endeavor to go for antenatal clinics and not deciding to handle everything by yourself. Do not go and have a lot of native concoctions. You don't know, even though everybody is wishing you all the best, they are packaging everything, but sometimes some are not scientifically tested and they are not proven. You don't know what are the harmful effects of what you are taking in through your mouth. So you must limit what you are taking, things that are not good for you. At this point, anything that is not authorized by scientific research may not be too good for you. So it is important to know that. And then pregnancy, there is this issue of craving, and mothers eat a lot of things. Eating uncooked meat. Uncooked meat is nobody is eating fresh meat.
Do people eat uncooked meat?
When we say undercooked, not really uncooked, undercooked meat, things like suya comes in. Okay. They harbor a lot of parasites Okay, these parasites can develop in the mother, and this time they can cross the placental barrier and go into the baby. That is the barrier between the mother and the baby, and the eye tissue might be a very good uh, place for it to hibernate and thrive. So it is important to know that suya is not the best of the food you can look for during pregnancy, and so also you have to take a lot of fresh fruits and vegetables, but ensure that your fruits and vegetables are washed and washed well when you are taking. So make sure on your own part the things you can eliminate so that you don't contribute to something that is harmful to you and your offspring that will be born.
All right. One of the things I don't like about glaucoma is that it doesn't come with signs. But what warning signs should
Okay.
parents, caregivers, and teachers look out for in children to aid early detection?
Okay. A child who is born with congenital glaucoma, for instance, it is not asymptomatic. It has a lot of symptoms.
Okay, beautiful.
Unlike the adult glaucoma that stays very silent and you cannot detect it. This time around, the complaints can be that there is a lot of tearing, okay? Water
Okay.
keeps dropping from the eye. The eyelids keeps blinking. We call it, there can be pain and blinking. That is called blepharospasm. And sometimes you also have the eyeball can enlarge,
Okay.
and such that if you don't take measures, the child's eye is quite elastic, is very soft. The walls of the eye, the cords of the eye is just like a balloon. The walls of the eye are like expansible at that stage, and it keeps increasing in size. So as the water is produced, whatever that is happening in congenital glaucoma is that there is a blockade in the path to drainage. That
Okay.
there is a spongy network, we call it the trabecular meshwork, where water that is produced, the aqueous that is produced, which is responsible for having the intraocular pressure and maintaining the eyeball in shape, is being produced, but the outflow, the pathway through which it has to go out, is blocked. Is structurally there is a problem, developmentally there is a problem. Sometime on top of that spongy network, there is a membrane, a cover that is formed. We call it is a remnant from the development. We call it the Barkan's membrane. It is there. So that is blocking that water from going out. So the eyeball keeps enlarging, enlarging, enlarging. And sometimes you can actually see the eyeball enlarging and becoming very bulging out. Sometimes you see that the whitish, but the clear part of the eye becomes very cloudy. It can even take the color of a bluish color. Okay, so these are all possibilities, and that child might have aversion to light. A child doesn't like the light at all, so the child can actually rub the eye, squeeze the eye either, because the reaction to light is very irritating to the child. So the child can decide to carry the hand and be covering the eye. So child will not tell you these are my complaints. When you have a baby, you look out for the complaints. If your child for some reason is always taking the hand and be covering the eye, it might be one of the earliest signs that is taking place, and you might just go to the doctor, and every doctor might not understand it. They might send you to the ophthalmologist, who will now come out and explain things in detail. They are going to do further investigations
To confirm.
confirm. Usually when it is suspected Examinations are usually done in the theater because baby cannot cooperate at that stage. We have to make the baby to sleep and take the pressure measurements, take some eye measurements, so that we know whether this child is actually having what we are calling the congenital glaucoma.
Okay, let's look at diagnosis and treatment. How is childhood glaucoma diagnosed?
Glaucoma, when a child presents with these conditions I have mentioned, tearing, bulgy eyes, some reaction to light, you come to the hospital, and when you see an eye doctor, after assessing you and taking a history, the doctor is going to tell you, we are going to examine the child in the theater, because the child is a baby, we cannot really do extensive investigation because baby cannot cooperate. So examinations are actually done in the theater. So we go, the child is made to sleep, and we take some measurements. For instance, the clear part of the eye, which we call the cornea enlarges, and we try to take the measurement. We call it the diameter, and usually it is higher in the case of congenital glaucoma. We also measure the intraocular pressure. Remember, we can measure intraocular pressure if it is an adult outside without all these protocols. We have to do all this in the theater, and then we open the eye and examine the optic nerve, so that we know what the child is having in the eye. And if there is a damage to the optic nerve, then you know we are working with the glaucoma. But sometimes, depending on the stage at presentation, if the cornea is no more clear, you may not be able to see the optic nerve. In that case, at that point, if the pressures have gone very high, eye is already bulging, at that point we should be thinking about going in for a surgery and make an opening into the trabecular meshwork, the spongy network that is blocked, so that the fluid will begin to drain out normally.
Is surgery always required?
Surgery
or there are other alternatives?
Surgery is the mode of treatment. It is the necessary treatment. There is no true treatment for congenital glaucoma. For congenital glaucoma, surgery is the way out. Okay, because whatever that is happening there is a developmental problem such that the drainage pathway is just like the kitchen sieve that is blocked. You have a kitchen tap, you have a sink, and there is a filter, and there is a visible blockade here, and this time there is a blockade, and it is a blockade that you cannot just go and create a tiny opening. We must open the membrane so that the fluid will leak out. The fluid will let go. So the treatment is just surgery. Surgery is the only way out.
I imagine a lot of children probably who have gotten blind because probably their parents don't even know what they are suffering. How many people know what is congenital glaucoma? And even when people know what it is, the next issue is the cost of the surgery. So I'm imagining that probably there are adults who started from childhood to experience this, but their parents couldn't even figure out what they were going through.
I wouldn't say the funny thing, the interesting thing about this glaucoma, the child cannot grow into an adult without the intervention of a doctor, because it is quite painful to see a child whose eye is bulging this way, and it is not like the eye will bulge, and there is a way the eye bulge, your eyelids may not even be able to close the eye. So somehow, if it comes to that, it is natural that the parents will find a way to the hospital, wherever the hospital is now. So what we are trying to say is, let that stage not reach that. When there are complaints, the child is having some tearing, when there are aversion to light, please come to the hospital. At that stage, we can preserve that sight for that. These days, we have a lot of parents who bring their children at that stage. So people are getting more enlightened, and when they see their children having problem, they tend to come to the hospital. So it is in those days, most of the time, by the time we see patients have bulgy eyes. Even till today, we see such patients coming from rural areas, bulgy eyes. At that point, it is a difficult experience.
So early presentation is the
Early
key.
presentation is very important for sight preservation. Otherwise, you are very sure you are going to lose your sight, and you might have to manage a blind child, and which might be more difficult.
Okay, if a child is diagnosed, what does long-term management look like?
Yeah, if a child is diagnosed with congenital glaucoma, for instance, early treatment, surgery is the way forward. And it is not that you are going to do the surgery one off and you forget it, because the glaucoma has not gone. You have only been able to relieve the eye pressure, and then there is a lot of phases. The growth phase keeps continuing, and seeing, the act of seeing is a learning phase by the brain. So it is important for the child to be coming to the clinic. Sometimes you have there are different problems. Sometimes it is the eye pressure related issues, in which case the surgery takes care of the pressure most time. Sometimes you might need the help of an eye drop, because the pressure control may not be sufficient at some point. Sometimes you might need the help of a laser. Sometimes the surgery opening you have created has blocked. You might have to go and open up, or go for a retreatment, do another surgery. Now, this is one aspect of managing the child in terms of pressure control. The other angle to the problem is vision, because you know that this is a child and he is growing, and his developmental milestones is dependent on his sight. If the child is deprived of sight, it might be difficult for him to carry on with academic activities. And not only academic activities, everything in life is a learning process. You see your parents, you learn from them. You see adults, you learn from them. So the vision is a stimulus for your growth and achieving all your milestones. So the next phase is managing how that vision is enhanced. You might have to have the help of glasses, and sometimes that glasses might not be optimal for that, because these patients might have much more challenge than you. So they might need low vision aid. Sometimes they need special education counselors and all that. So it's a holistic approach in terms of long-term management.
Okay, and of course, you keep talking about early presentation and also regular checks up. People this side of the world were not very big on going to check hospital. Sometimes they'll tell you, person never chop. But then at the end of the day, if you lose your sight or that of your child, what have you gained? Let's talk a little bit about the importance of early presentation and regular checks up.
It is very important present with your health challenge early as possible, because anything that is found early has some form of solution that can reshape your life and redefine your life. So if you come early, you may be able to secure your vision, and if you secure your vision, that means that child has the prospect of going to school and developing as a normal individual or a near normal individual. But if you come late, now all what we are doing is we are managing the pressure, just crushing the pressure, but at this point your sight is gone. And then that means we are working with loss of vision or blindness. That is a bigger challenge. Now the child is a child of special needs, and your overheads become more, because caring for someone with a special need means you have to have more involvement. You need a care provider. You need to have other means of incorporating him, more involvement in terms of education. So now two things might happen. If the family is well to do, they will push as much as possible to carry on with the next phase of life. The other thing that can happen, if the family cannot cope, the child is abandoned, and now he becomes a number in the family and not someone. He's more or less redundant. At some point, this individual grows with a lot of depression and setbacks, and which is not necessary. So I know poverty is a vicious cycle. So blindness is another vicious cycle. So it's early detection is very important in fighting any of these problems.
All right, just before we open up the talk lines, parents and schools work so much with the kids. There's a whole lot of activity around parents and the schools. So, what can parents and schools do or begin to do to protect the children's eye health generally?
Very good questions. Now, as the child is growing, the first interaction the child has is with the parents. The next social circle the child belongs to is the school. And as a matter of fact, the child spends minimum of 6 to 8 hours in the school every day of his life, and the teacher interacts with the child most of the time. Parents these days are also working, so they don't even have that 8 hours with the child. So when a child comes to the school and you see that the child is having challenges seeing the board, trying to catch up with daily activities such as copying notes, reading his book, it might not be that the child is not smart. It might be that he has a problem with his sight, and this is why he is unable to cope. One of the things you can do if you find such a problem, call the attention of the parents, especially the mother, because the mothers are usually close to the children. I didn't say the fathers are not close, but there is
They are more.
So call the mother, call the father, whoever that is free, and explain to them this is the situation. That might mean they will go to the hospital, and then sometimes it is as simple as wearing eyeglass and the matter is solved. And in as much as a glass is prescribed for a child, this is not in terms of glaucoma. If you have any other condition, refractive errors, and you are prescribed of the glasses, ensure that your child wears that glass every day. Most time we also see parents getting the glasses. The child is no more using the glasses. Either the child has misplaced it, child has kept it in the house. So you have gotten the glasses. The glass is not on the eye of the
I
child.
don't know whether it's Nigeria. Does it happen in other places? There are people who have this reservation about their children wearing glasses.
I know a lot of parents have reservation about children wearing glasses. Parents feel slighted that my child is born normal, and my father and mother were never having eye challenge. Why is my child wearing eyeglass? It is not necessary. We keep advising them it is not true. It is just an error, and it can be corrected with the eyeglass. And at that phase, if you don't really stimulate your eye with the eyeglass, there is what you call lazy eye. Eye forgets to learn how to read. So, the act of seeing is a function, is a learning process which is taking place with the help of the brain, and the brain helps the eye in learning, and this phase is active from 0 to 8 years of life. Okay, now at that point, for some reason, the child is supposed to wear an eyeglass, and you deny that child of that wearing eyeglass. Your eye becomes lazy, and I stop learning how to see. So God has given you a structure called the eye, which is very normal, but then this eye has refused to learn how to read. So we call it the lazy eye or the amblyopia. So it cannot be corrected after 12, 13, 14 years, because we try to stretch all these things now with help of drugs. But it cannot happen after that. So parents should endeavor to allow the children to wear the glasses, and then the child should be educated so that he takes responsibility for his sight. And then at an early stage, child cannot own up, so you can request the help of the class teacher to ensure that your child wears the glasses in school. So the teacher takes note of that, which can now become a social network in contribution of a well-developed child.
Okay, we're going to open up the talk lines in just a moment. Alright, welcome back. The talk lines are open for you to ask questions or share your experience. We're talking about glaucoma in children, and if you've noticed any other ailment in your children, especially as it regards to their sight, do well to bring it up. On Facebook, we have Okon Namde from Labor Line Afikpo. Glaucoma is a serious ailment that has caused blindness to people. 0909 771 1009. Quickly get your calls in. Some of you wait until we're almost done. We have less than 20 minutes to go, so the earlier the better. 0909 771 1009. Let's get your comments quickly. Okay, but let me ask, what is your strongest message to parents listening to this broadcast, especially as it relates to the eyesight of your children?
As it relates to the eyesight of your children, treat their eyesight very carefully. Please ensure that your children have an eye check done as soon as or before they start school. It will help you, because sometimes a lot of eye problems are there. Children these days that we are engaging ourselves in a lot of near work, that is using tablets and phones and all of them, and so children are basically becoming short-sighted, and if you don't correct all these errors in timelessly, they will develop a problem that cannot be corrected later in life. So as they are starting school, a week before that, you can stroll into a clinic, let them be checked. Then after, you don't need to go to an eye doctor every year. Then if you finish the primary section, during the secondary section, come again before going to school. make sure they are checked. Please, most of the school have a paper, a medical examination paper, which also have an eye component. And for some reasons, parents don't follow it as a routine process to go and check with an eye doctor. Sometimes parents feel it themselves. Sometimes they ask a doctor to put the figures. So after that, you are given a paper. You give a clean health bill of your child without knowing what the true situation is. You are only cheating yourself, and you're cheating your child and cheating your future. It is always good. It just takes one day. Just 1 hour, 2 hours, you are done. But do that as a responsibility, as a favor to yourself, not to any other person. And let every part be checked. Don't just write figures and stamp it, because in Nigeria everything is possible. You can go to a chemist and he put a signature of a doctor, stamp it and give you, or you pay 10,000 to somebody and you will get all the papers done. Please, just do the needful. Get your eyes checked. It is very helpful.
Okay, every parent should know, but I doubt if they know how important the eyes are to learning and to life generally.
I'm sure many of them don't really understand that aspect. Sometimes we hear parents telling that my child was unable to cope with classes. Oh, I did not know that if I had provided these glasses, it would have been better. Much later, they actually confide in us that it would have been better. So it is important that you do a check. It only takes few hours to get a check done. Go to hospitals. There are a lot of hospitals. Teaching hospitals are there. Private hospitals are there. Just take a day and just go and get it done. We bring out a day to go to ShopRite. We bring out a day to go to other places to catch some fun. So we can also bring out a day to enhance the life of our own children.
Okay, maybe you should go ahead and let's find out how important the eyes are. Because if I consider something important, I will invest time to it. I will invest money to it. Even an adult, sometimes they don't understand how important sight are until they lose it.
I agree with you. Eyes are a very important part of your body. If you disagree with me, whatever you can do is to close your eye wherever
and
you
try
are
to move around.
and try to move inside the small area where you are. Be genuine, just close your eye and see if you can find the door, find the path to your door, and see how difficult life gets. Just do that exercise and know whether it is easy to cope. And for a child this time around, eye is the main part to his development. He has to read to become somebody, and everything about him is a learning process. He has to look at you, how you are dressing, how you are walking, how you are driving, how you are basically doing anything, because the child keeps looking at you and start copying. Even the way you hold your phone, the child copies it 100%.
So development is stalled.
Development actually is by seeing. So it is important that eye should be helped as much as possible, even though we all take for granted nature gives us everything. But it is unfortunate that for every child, nature did not do it the same way. Some children have challenges, and we should know that. And also remember that when a child visibly shows that he has challenge, for instance, you are watching television and the child, for some reason, must always go close to the TV to look at the TV. Or he holds a phone and comes very close to the phone. He carries a book and he looks at that means something is wrong. It is not his habit. Sometimes you push your child and say, oh yeah, go and sit down. Don't do this, don't do this. But the child is not comfortable sitting at that place and seeing what he is appreciating, because something is not okay in his eyes. That is why he runs close to the TV or the gadget he is. That means there is a problem he is having, and he may not be able to tell you, I'm having a problem. So it is usually for an adult to know that this is not a normal behavior. This looks like an abnormal behavior. You have 3 or 4 children, and one child is looking different from others. Sometimes it might be unfortunate. All the children behave the same way and they have the same challenge. Especially now we have what you call myopia. Short-sightedness is becoming an epidemic. Okay, so because of the near work we are doing, phones and gadgets have become babysitting devices these days. Parents are busy. We give our children the phone so that they don't disturb us. So the eye now begins to adjust itself to seeing only near things, and it fails to see far things because we are not giving that eye room for growth. So it is important that we are able to develop that aspect. In as much as you engage your child in near work, always bring out some time. Let the child also do some distant work. Go out, play outside. Unfortunately, things have changed a lot. Schools don't have playgrounds. This small office can become a school, and you call it and that is where we are in this country. So parents have to go a mile further to see that some of these things are put in place, so that we do some distant work so that the eyes develop normally, especially as children. All the developmental milestones have to be achieved for a perfect growth. Otherwise, there is a problem.
All right, our talk lines are still open. I don't know whether it's the network or Dr. Suhanya is doing a great job, and so you don't want to ask questions. But let me hope that you can hear us and that you're taking note. It was profound hearing that children learn through their eyes, through what they see. I got that one. This is the first time I'm hearing that, but it's true, because they have to emulate, they have to watch you, they have to. In fact, they learn from what they see adults do. Okay. We just have a few minutes more to go. You should be sending this early, please. Okay. So to join our glaucoma WhatsApp channel, send glaucoma to 0810 435 8093. Okay. 0810 435 8093 on WhatsApp, so that you can be added and learn more about glaucoma. Don't send the messages as a SMS or text message. Normally, some of them will send as text message and they say, add me on WhatsApp. If you're on WhatsApp, you can simply just chat on WhatsApp. It's easier to add you on when you're on WhatsApp. So you can DM 0810 435 8093. Okay, I hope I don't have glaucoma. Okay, so closing remarks, Ma. Let's get your closing remarks.
Yes. Now back to the topic we were discussing: congenital glaucoma, primary congenital glaucoma and childhood glaucoma. Please ensure that if your child has a problem with his eyes, endeavor to go and check with your eye doctor. And as the child is growing, if there is any problem with the eye, you must take that child to the doctor. Also remember, we talked about juvenile open angle glaucoma. It has similar presentation like the adult onset glaucoma. It gives no symptoms. So if you have family history of glaucoma in your home, father or mother having eye challenge, because of glaucoma, or they are blind individuals in the family, that family, the children must present early for eye checks, so that if there are any possibility of having anyone in the family, any child presenting with this problem, we can fish them early. And if glaucoma is caught early, prevention of blindness is highly possible. You may never go blind. So that is the take home. So catch them early and you will not go blind. So it is on your onus to make sure you present early with your eye challenges, so that you preserve your sight and continue with your normal life like every other person.
All right. In case you just joined us, is the Glaucoma Awareness, and it happens every Friday. Do catch up with next week on, and I hope you learned a lot. Thank you, Dr. Sohanyo KK. Thank you so much for your insight. And for those of you who listened, I hope you make use of what you've heard. If you have children who show those symptoms, don't take it lightly. You might be joking with their sight entirely.